So today we're going to talk about lower back pain and how the butt wink or spinal flexion causes some issues with some discs in your low back. So when you go into excessive spinal flexion in the bottom of a squat, for example, shown here, what's going to happen is it's going to compress the discs in your low back and it's going to cause some issues. So how do we fix it? In relation to this flexion and extension of the low back, you need to make sure that you have adequate flexibility in your ankles and your hips and in your thoracic spine, because you want to keep your torso as upright as possible, keep your knees out, keep your body in a nice upright position, and keep that natural extension of the low back in place. So you should have a little bit of extension in the low back, not a massive hyperextension, but there still should be some extension in the low back when you deadlift and especially when you squat. What we're trying to avoid here is the rounding of the low back or the butt wink or that spinal flexion that's going to happen, because that's going to cause compression of the discs and it's going to cause issues down the line, especially if we load it. So under heavy load, maybe doing a lot of repetitions as well, or even doing jumping and impact can cause problems. So this counterbalance squat here, you can see this is a great exercise to retrain the movement pattern. You're thinking about your tripod foot, but you're also thinking about keeping your chest up, driving your knees out, keeping that natural curve in your low back. You've done a little bit of specific mobility to help that, and now we're trying to retrain the pattern to fix it. So when you get a bar on your back, you'll be able to maintain that position a little better. A little bit of before and after here comparison. See on the left, we've done no real specific mobility or activation drills, massive flexion of the low back and spine. On the right, much better safe position. So again, this is the key thing you want to focus on. Everyone's going to be a little bit different, so you might need to individualize your mobility strategy to get the best results for you. If you need any help, reach out.